Was associating for a couple of years and then opened my first office in 2007. Along the way, I met my wife when I was in residency. She got an MBA. She had a dental background from Serbia. Together we started this entrepreneur journey. We're actually opening our 12th location in a couple weeks. In the meantime, after COVID was done, I got diagnosed with a genetic defect of my heart, so I had sudden open heart surgery. From there, I didn't work for 3 months, so I was out of the chair completely. And then I started really working the whole company remotely just from my house just during my recovery.
Is that kind of the situation that kicked off like running multiple dental offices?
Honestly, David, and I get this question a lot. Did I envision it? No. Did it kind of just organically happen that way? It did. And I have to say, after my open heart surgery, I then just got much more in line as, let me see how much I can take this. Like I didn't think I could go this big, and now I have other ideas of what we can do to expand it even more and have it even larger than it is right now.
Welcome to another episode of the Dental Dialogue. We've got an awesome guest here, somebody who it's been a quick turnaround. We got introduced to him, I would say maybe a week ago. We have Dr. Bobby, who is he's a pediatric dentist, but he also does something on the side, which is fantastic. He helps other entrepreneurs, other successful entrepreneurs who want to optimize their life, their wellness. So we're excited to have him on board, get chatting to him a little bit about dentistry, about his social media brand that he's popped off on with as well. So welcome. Thank you very much for being on here.
Thank you, Josue. It's very nice to meet you, David. Thank you again. It's a pleasure and honor to be with you guys and, have a little chat and get to know each other and see where it goes.
Perfect.
Great.
Yeah, for us, it's exciting to have someone on who is not just a typical dentist, I would say. Definitely not. And we are excited, and we would just love to hear like a bit about yourself. If you could just introduce yourself to the people who don't know you, what you're doing, and what kind of makes you special as a dentist.
Okay. Well, you guys, my name is Bobby Garofalis. I was born in the United States. My parents were Greek immigrants, and in typical immigrant fashion, I was kind of pushed to be the doctor of the family. So,
Yeah.
kind of went in that direction, then kind of slowly found my path to dentistry. I wanted, I guess, more 9 to 5, sort of job, which dentistry, that's how it was basically marketed and branded as, you can have your everyday life. Then I found myself kind of guided more towards pediatrics. I liked working with younger patients, with the younger kids, kind of started liking how the model of pediatric dentistry works. I graduated in 2002, did my residency in 2004, and was associating for a couple of years and then opened my first office in 2007. Along the way, I met my wife when I was in residency. She got an MBA. She had a dental background from Serbia. She's also an immigrant. And, together we started this entrepreneur journey, which has definitely been a journey. It's been a roller coaster. You enjoy the ups, hang on for the low. You just kind of keep riding up, basically. So here we are 20 years later after I became a pediatric dentist.
That's amazing.
Wow.
Yeah, we've seen you. Is it like 9 practices that you currently?
We're actually opening our 12th location in a couple weeks. We're opening an orthodontic office as well. So we're primarily pediatric. We have 9 physical pediatric locations. We're doing orthodontics in some of them, but we're opening one that's just orthodontics itself. We have a separate surgical center that's part of our group. So that one office is a surgical center. And we also have one high-end cosmetic adult dentist, which we kind of feed some of our patients to go there as well. So mostly pediatric, but we are kind of branching out into the other fields and specialties as well.
Wow. I mean, how's that experience been like for you? I know that you said that you have highs and lows.
We only have 20 minutes, right? It's just break open the wine for this discussion.
Yeah.
It's been a journey, and I feel like the journey is still going. We've had ups where we grew very fast, and then we had to kind of stabilize because it felt like it was a house of cards running the business. And then we were stabilizing, and then COVID hit, and that, it set us back a little bit, but then it kind of ramped us up to grow again. In the meantime, after COVID was done, I got diagnosed with a genetic defect of my heart. So I had sudden open heart surgery 3 years ago this January. From there, I didn't work for 3 months. So I was out of the chair completely. And then I started really managing and working the whole company remotely just from my house, just during my recovery. Went back into the chair a couple of days a week. And then I got out of the chair completely a year and a half. And we've been really like since COVID, we're having double-digit growth every year, and which is presenting new challenges. Obviously, we're expanding, and it's not the best time right now to get loans, so we're going through another little roller coaster ride. But like I said, you just enjoy the journey, I guess.
Is that kind of the
Wow.
situation that kicked off like your entrepreneurial journey in terms of running multiple dental offices, or did you have them beforehand already?
Honestly, David, and I get this question a lot. People are like, "Oh, did you envision having 12 and how many more?" And I'll be completely honest with you. I thought, when I was going through dental school and then into residency, I was in the mindset, I'm going to have two practices. I'll have a couple of associates, we'll take turns to go off. I'm going to go to Greece a couple weeks out of the year. It was kind of a very, at the time, I guess for me, felt, big, but in hindsight, I guess it was more of a limiting mindset. And for me, I guess over time, the goalposts just kept moving and more, and we were kind of expanding where we would acquire practice, acquire another practice, have a de novo. In the meantime, we'll get to this another time. I partnered with someone, which turned out to be a very bad decision, and that just literally finished up 3 months ago as well. So again, did I envision it? No. Did it kind of just organically happen that way? It did. And I have to say, after my open heart surgery, I then just got much more in line as, let me see how much I can take this. Like I didn't think I could go this big, and now I have other ideas of what we can do to expand it even more and have it even larger than it is right now.
Well, I mean, you've taken it like really far compared to other dentists who are in the same space as you, and especially in light with what you've had to experience that time. I'm sure it was a very difficult time for you. And how
Yeah, with
did,
the medical condition. Yeah, it
yeah.
was. I mean, and it was funny because at that point, I remember that was the summer of 21. We were coming through COVID. Were starting to grow, and I had started then going to 3 days a week. I was 5 days a week, then 4 days a week. And then that summer, I'm like, I'm going to go to 3 days a week. And, life felt really good and at peace. And then that hit, and going through that whole process and having surgery within 8 weeks of getting diagnosed. I mean, I didn't have time to think. And at that point, we were growing enough, and I had really, really good associates that I didn't question having to step out because I obviously had to. I wasn't worried that
Mm,
the company wasn't going to be fine without me. And then when I started recovering at my house for those months I couldn't work, then I saw that I was really effective behind the screen and messaging my managers and my other doctors, and taking it to a new level that I feel like I said, since the surgery, the growth has really ramped up. It almost was like it took the surgery to be a life-changing experience for me to take it to a different direction. And I might add, we're completely private. It's just my wife and myself. There's no PE, there's no investors. We are literally, have bootstrapped the operation, and it's been, without being uncomfortable, you can't grow. So,
mm.
there's been
Yeah,
periods of having uncomfortable feelings, but that's kind of led to growth as well.
Yeah.
that's
How does it feel for you to know that, you know, you've had a good amount of growth with you being out of the chair? I know that when you before you had your medical condition, you like decreased the amount of time that you worked and you felt happy with that. But how does it feel for you to know that, after doing not being in the chair, maybe recovering, that your growth was steadily increasing and that you weren't necessarily needed in the practice? It must have been a change for you, I guess.
No, I completely understand your question. I guess for me, like, and the one thing I really did well, I guess that's kind of helped me a lot. I did not brand my pediatric company to be Dr. Bobby. Everyone knows me here as Dr. Bobby, Dr. Bobby, Dr. Bobby, Dr. Bobby. And I would have patients waiting and parents wanting to request to see me and to see Dr. Bobby. But I think the good thing is I did not brand the practice or the group to be Dr. Bobby, if that makes sense. So,
Hmm.
when I stepped out, there was still the identity of the group and the company that was not tied to my name. So I guess for me, it was a little bit seamless. It's like, all right, well, I don't have, my name's not attached to this. I can work behind the scene, but it's taken its life of its own, I guess. So I don't think it really bothered me that, I had to step away and that I wasn't needed, because I felt like I was now needed in a bigger purpose to really take the growth up to a next level.
So yeah, that would had been my next question. So when you also stop treating, is it something that you sometimes miss? Because
Mm,
we kind of get that a lot since currently, like we said, we are not working clinically, and of course we
Right.
get a lot of critics from family, from friends. But I, for example, realized during my time in dental school, I love dentistry, but
Mhm.
the entrepreneurial part of it that we just kind of stumbled into by doing YouTube. Then one of the professors saw our YouTube channel that was about traveling. We helped him out with his marketing. Yeah, how is that for you? Is it sometimes, would you say, for example, that it's not as fulfilling to not really treat the patient firsthand?
Yeah, so I mean, when you're working in the chair, first of all, like it's almost like you're in a sanctuary when you're working in the chair, because for the longest time I was just working in the chair and I would run my schedule and it was great. And then you get quick dopamine hits when you're a doctor and you see patients. Like this 5-year-old, I did the extraction, he didn't even cry, dopamine hit. The mom loves
Mm.
me, dopamine hit. The staff loves me because I finished a half hour early, dopamine hit. You're getting constant dopamine hits. And you just have this really good feeling and it would make the day go quick. And then, when you're in your sanctuary, you're not worried about, what's going on with financing of the company, what's going on with legal, what's going on with just other things that you can't control. As I got busier, I started having to work on emails in between patients, and that was getting a little difficult. Now that I'm completely out of the chair, I don't have those feel good dopamine hits. Things are just take a lot longer, whether you're dealing with banks and loans and financing, whether you're dealing with legal, whether you're dealing with contracts, whether you're dealing with recruiting, you don't have that same dopamine hit
Mm,
that when you see patients, especially pediatric dentistry. Look, if you can take the scared kid and make him love the dentist and have a great experience, it's such a feel good feeling. Then you're the best person in the room because the parent loves you, everyone loves you. Now,
Yeah.
when you're in
mm,
this other role, you don't have that instant satisfaction, and that's what I've had to learn to adjust to the past year and a half or so.
yeah. That's pretty interesting because actually it's for the first time that I hear about this, and I
Mm.
was wondering all the years why most dentists are, and I think maybe I'm wrong, but my opinion is dentists are generally speaking not that good at business. And
Mhm.
would you say that that is maybe the problem? Like it is misleading that they always get good feelings by performing their work, their clinical work, but then because of that they forget about the sit down annoying work of legal taxes
You
and all that stuff.
You know what? They get a lot of dentists, I think they get validation from the work that they do, whether it's a pediatric dentist and rehabbing the kid's mouth in a very pain-free way, or whether it's a cosmetic dentist that's, changed someone's smile, or whether it's an orthodontist that, again, just made a beautiful smile. Dentists get that validation, if that makes sense.
Hmm.
You don't get that instant validation when you're working behind the scenes. But I think most dentists, and don't necessarily, a lot of dentists have an entrepreneurial spirit, but I don't think most dentists want it that bad or to take it to the heights that you can achieve it to. I think most of the dentists just like kind of having their 9 to 5, working 4 days a week. What I see with a lot of associates coming up, because I have 15 doctors working for me, and this new crop of generation that's coming out, they don't want necessarily ownership. They don't want to run their own practice. They want their comfort of practicing in a already established environment. They want their time off. They want their freedom. And I think that's where a lot of people now coming out of dental school are looking for. I don't see as many entrepreneurial dentists that want to open up their own office or have 2 offices anymore.
Mm.
Why do you think that's the case? Because I've been wondering that as well.
I think it's a lot harder now in terms of getting financing. I feel like that I came right in the middle. Like, I came at the end of the golden age of dentistry where, you just put your shingle up, your name up, and then you get busy and you have one
Mhm.
practice and the expenses were low and, you did very, very well. I came right at the transition when that was ending. And then when I started coming, you started seeing the groups forming and then the DSOs forming. And
Mhm.
at that point, a lot of dentists, and, I went through the recession in 2008 with the financing. I went through COVID, that it just became more and more difficult for dentists to open up their own practices. And it's a much different market now with supplies up, the labor costs are up, so that it can be daunting. It's not for everyone to try to open up your own practice. And again, I encourage my associates, if there are any that want to open up, I tell them open up. You can still work for me part-time. We can have a symbiotic relationship, but just a lot of them are not opening them
Mm.
up as much as my first crop of associates I had years ago.
Yeah, I
Mm.
think also to say something about it, I think it's also just a thing of our generation. I think it's not only in dentistry, you see it across the board with
Mhm.
every job. Like when I just look around, I barely know people who start businesses in our generation.
Yeah.
But when I look the generation above, like my parents, basically every friend of my father is a somehow business owner.
Mhm.
So I think it kind of yeah goes hand in hand.
Especially, I feel like, the generation above me, like my father's generation, and especially immigrants that came here, they had that just much more entrepreneurial spirit and drive to make
Yeah.
Mm-hmm.
and it's passed on to some of the second generation hyphen Americans like myself. And then the further down you go, I feel like it's not there like it used to be.
Yeah, it's
Mm,
like
mm,
it's kind of so we also kind of, I mean, we have it in Europe, but it's kind of the same here for us, where our
Mhm.
parents and grandparents just gave it on. Um, yeah, what I'm also interested in is what you do basically with wellness. You work out a lot. You are in fantastic shape, I would say. Um,
Ironic in that I have a heart condition too. So.
yeah, but had you always been that much into let's say self-improvement and yeah, just living a healthy lifestyle?
Honestly, no. I mean, I've always wanted to look fit and be fit. I just never really put the effort in, through my 20s. It didn't start until after my first kid was born in 2007. I want to say like a 3, 4 years after that. I just noticed I wasn't feeling well. I was already in my mid 30s. I was sluggish. I felt bloated. I had like a skinny, fat dad bod physique, and I just didn't like it. So I just kind of incrementally got into fitness and wellness. I started playing with becoming gluten free. And I read that
mm.
because Novak Djokovic, the Serbian tennis player, my wife is Serbian, by the way, like I said. So I started following him and he became gluten free. And I'm like, you know what? I'm going to try this because at that point I had a lot of GI issues. And funny enough, it really helped. Within a month of being gluten free, I noticed I started de-swelling. I got thinner. I felt better. And it literally took that little spark to kind of start it. I started working out a little bit, but nothing serious. I started doing hot yoga on top of that. So a year after, I started doing hot yoga, which then started helping me with my mental clarity and just mental strength, and was very cathartic physically and mentally as well. And started noticing my physique changing a bit. I started seeing a little bit of ab, and at that point, I was following Grego Gallagher and Kino Body. So when I turned 40, I signed up for Kino Body, and I finally had an actual regimen I could follow. I started following it religiously. I started tracking calories and doing his reverse pyramid
Mm.
training. That's when I noticed my physique really, really started to change. And kind of morph into that way. And then since then, from 2017 to now, I would go through periods of, working out consistently. I'd have a trainer, I'd go to the gym at least 3 or 4 times a week lifting weights. And it was just little things that just kept stacking, stacking, stacking. And then, I would incorporate, other different types of workouts. And over time, I mean, it wasn't like my physique just magically turned like this. I think it's just being a consistent person into working out and into fitness that evolved my physique to the way it is. Even with my heart surgery, which was sudden at that point, I bounced back pretty quick. Like I went to the gym, I think 10 days after my open heart surgery. I didn't
Wow.
lift, but I just started doing like I pretended I had weights and I would just kind of do this.
Mm.
All right.
I would do air weights. So that was
Mm.
good. My mental recovery after the open heart surgery was a much different fashion. Like I had a period of depression. Everything was foggy in my head. I had a dark outlook a little bit. And I want to say that I've probably worked on self-improvement and my mental strength a lot more since the open heart surgery. It's almost like it took the physical body and optimized it. And now the last few years, I've kind of been working on my mindset as well.
Yeah,
How
and
did
and
that
s-
affect running a business, like as a
mm,
dentist? Like if you could talk about that, since also especially dentists, so many dentists have problems with their back.
Mhm.
They when they turn 60, they can't continue working. Yeah, what is something that you for yourself as a dentist could realize in that time when you got started?
In terms of like what mental strength,
Um,
mental.
in terms of, for example, practicing and also running a business, like
Mhm.
when it's yeah.
I mean, in full disclosure as well, I probably would not be this far business-wise without my wife. I mean, it's almost like you have two entrepreneurs and it's almost like who's the risk take, like who out risks who. So, with her, I almost felt like I had this security blanket. It's like, okay, well, let's do this. Well, let's do this. So, I think I wouldn't be this far in my journey without her. So, and I tell people that DM me and follow me and whatnot, I tell them probably one of the most important decisions you make is who you're going to end up with and who you're going to marry. Because if you guys
yeah.
both have the same goals and same ideas and same vision, then it'll take you very, very far in life. So for me, I could focus on the clinic side, especially at the beginning, and she would focus on the business side. I became a very, very good clinician. I honestly was an excellent pediatric dentist, whether it was sedation or anything, even talking to parents and getting parents to trust me too. But as we got bigger, I started seeing I had to take more of the business side because then she was getting too busy. So I think for me, just it kind of incrementally developed. but having my wife as the security blanket as well has definitely helped in this growth journey also. And background, she was becoming a dentist in her country, which was Yugoslavia at the time. The wars broke out. She had to stop dental school, and that's how she immigrated here. So she had a dental background, ironically, when I met her.
Mm.
Oh, okay. Yeah, that's super important. Like having somebody, and my father also says the same thing, that the number one decision that you're going to make, first of all, if you're religious, is who you decide to, devote your life to, in terms of
Hmm.
what God you have, and the second is who you decide to live your life with. Because if you want to be married, ideally you want to be married for forever.
Hmm.
And that's a super important thing, that a lot of people don't realize, that you have to have a goal in common to be able to reach it and also go much, much further. And yeah, it's awesome that you had that kind of similar goal also with your wife, and you've been able to achieve everything that you have been.
She calls me like I'm your first guru because after the heart surgery, I started following other Instagram people and,
Yeah.
joined the Kino Body Mastermind and met other people. I've gone to other like Collins and all that and whatnot. But she's funny. She's like, you know what, honey, I've always been your first guru. You just never listened to me half the time. So yeah, I need to
Yeah.
listen to her more often. But yeah, like you said, like your father, I mean, I don't know how old you are, but your father's probably not much older than me. And he's very right. It's who you end up being with, whether you are adaptive in the same, culture, religions. I think that's important too. If you guys don't have the same beliefs or same way
Hmm.
you want to live your life, it's not going to work. And having that same vision just takes that even further, in my opinion.
Yeah. And speaking
Yeah.
of your wife saying that she was your first guru, you've kind of become a guru yourself now, haven't you?
I mean, yeah, I don't really have much of a coaching side business. My stuff mostly is, people will DM me, especially if they're, ironically, I get more younger people, like 20 to 30, that DM me about, business and health and wellness and mindset and stuff like that. So where that's going to take me down the road, I don't know. I enjoy helping people. I enjoy connectivity. I enjoy giving my wisdom. Um, Whether it's, on the physical side, the wellness side, the mental side, it's something that does give me satisfaction and purpose more is to espouse, the wisdom that I've accumulated over, especially the last 10 years, if not 20 years, if you count my professional career.
Mm.
And those people that are contacting you just out of interest, is it mostly people that also are going to like dental school, or is it just random
I
people?
have a few that are in dental school because like I will put on my stories, we have a new office opening or new expansion and they'll ask me, oh, how did you do that? Or how are you running this? So I get some of that. I get a lot of younger guys that are trying to like start businesses and they're asking me, different opinions on whatever it is, like financing or just even advice on just little things, and then I get another subset that are like, well, what's your workout? What are your macros? How are you staying so lean all the time? And for me, like at least with the wellness, it's on autopilot that I don't have to think about it too much. So I just tell people, don't overthink it, don't overcomplicate it. So it's interesting. Like, yeah, I just have a bunch of different groups that kind of started messaging me and following me.
That's
Awesome.
great.
Well, I think it's great that you're giving back the knowledge that you've accumulated over this whole period of time, whether that be business wise, health wise, wellness wise as well. And if you could, like, let's
Mhm.
say for some of the dentists, I know that you
Mhm.
have a bunch of different groups of people who are contacting you. For the dentists, what is like one common thing that they ask you that you could maybe answer here?
I guess a lot of them would ask me, or what I could answer for them is, how did you make the decision to go from one practice to multi practices? And, I tell them right away, it's like, what type of life do you want? It's not for everybody to start scaling the way we have. You have to, how much risk tolerance do you have? There is a lot of risk involved. How lean can you get? Lean meaning, how lean can you start living your life when you have to start putting your own money into the practice to build it up? So, I just tell people to self-reflect, look in the mirror, and see what kind of life that you want and what kind of risk that you want to take and how much can you tolerate because it can be bumpy and it can be up and down. But at the end of the day, if your goal is to have multi-locations, if your goal is to join into a big DSO and put in the work, then just go for it because you only have one life to live. If you want a much more simple lifestyle and there's not much that's going to make you happy with your life, then keep it small and be happy with your decision. Ultimately, it's your decision on how you want your practice and your professional life to mirror.
Mm.
Yeah,
That's awesome.
that was
That's
amazing.
great advice. I
Yeah,
think that's really good advice. You know why? Because
yeah,
a lot of dentists they see what you have and they want to emulate that, but they don't realize that maybe the life that you're living is not the one ideal one for them. Everybody's so
yeah.
different. Everybody wants a different kind of
Yeah,
work schedule.
100%. You're going to make sacrifices. You're going to make sacrifices with your family. You're going to make
Mm,
sacrifices with yourself. You're going to make sacrifices possibly in your health. I mean, a lot of, what we've gone through, it's probably taken a toll a little bit mentally with some of the
hmm
things that we've had to go through with this roller coaster of an entrepreneur, neural spirit in dentistry. So again, I just tell people, look yourself in the mirror and tell yourself, what can you tolerate and at what price before you jump into something that might prove to be too difficult. I
Great.
still ask myself sometimes that as well. I'm like, what am I doing?
Yeah.
It
Why?
happens at all
I'm 48
levels.
and a half. Why am
I
I still doing this?
yeah, it's I mean, but for us, I think it's very inspirational, even for us, because
hmm
right now at the situation where we decided not to, I mean, right now, next week we are going to pick up our diplomas. We are ready to work. All our colleagues are already working, and
hmm
we are just out there trying to build up different things. And of course, it's also a much more bumpy road, but luckily we have a lot of people also supported us and said, guys, you
hmm
definitely should try this, go down this
Mhm.
way. But to hear it from people who are long time in the game, it's definitely a game changer to just yeah, stick to the plan and keep
Mhm.
going. One last question: what is kind of, if you have that, a vision for the future of what you're doing currently, like
Mhm.
regarding the practices? Is there some goal that you set, or do you just see how life comes about?
That see how it comes about was probably the first phase, the first probably 10 to 15 years of how I was practicing. I didn't really have a vision. It just kind of was going. My wife and I have a vision now, and we're at 12 locations. I don't know. Maybe it'll go to 20 over the next few years. Maybe it'll go to 30. It just really depends on how the cards lay out. And I'll be honest, full disclosure too. My journey with my heart is not done. I'm gonna probably have to have another surgery at some point. This is something that's gonna have to happen several times through hopefully the course of my life, which will still be long. But I think for me now, knowing that I have to have another surgery, it could be maybe in 3 years, 5 years, 10 years, 15 years that I guess I'm trying to push it as much as I can right now until that next surgery. So I think that's kind of what my goalposts are. It's like, well, let's see what we can do until the next surgery. And then I have to go through that whole process again of recovery. So I guess, for me, it's, let's just see how long I have until I have to start shifting gears and preparing for another surgery.
Okay.
All right.
Well, it's how long you have left until you have to, start. It's not, I mean, shifting gears and for recovery could also be an opportunity for change like it was last time, right?
Yeah, 100%. I'm trying to keep that mindset as well because, for me, I have to get checked every 6 months and,
hmm
it's always a little bit nervous. It's like, all right, well, how's it looking? What's it doing? Do we need to go back in there and tweak it again? So yeah, you putting it that way is a brilliant way of, turning what could be a difficult situation into, okay, what's this next opportunity going to present to me after going through another surgery? So, maybe after
Exactly.
the next surgery, I'll have, 50 practices. Who knows? So
Yeah.
I'm excited to figure out to see what
we'll
comes
go from
about.
there basically. But
Then we do
yeah,
the next episode.
Yeah.
right. Well, and another advice I would give to just this, it's triggering my head. Another advice I would give other younger dentists is, align yourself with the right people. Pick the right partner, pick the right consultant, use someone that has proven that they have been able to take other practices to a certain level as well. So for me, that's probably a very important thing is aligning yourself with the right people.
All right.
Great.
Yeah, that sounds good.
Well,
Especially
it's
as
been a
an
pleasure, and I mean,
yeah.
like, yeah, it's been super inspirational, like the story that you have. Um, Also the things that you're starting now, I'm excited to see where it's going to go.
Yeah.
Definitely, I'll be following up, and yeah, you've given a lot of good pointers, not just for dentists, but other people who are watching, who can go home and can really implement straight away inside their lives, really. And it's
And
more so just not to think too hard about things.
right, don't overcomplicate. I mean, again, I'm a little bit difficult because we've diversified. We're playing with real estate. We started a anti-aging med spa as well here in Virginia Beach. So we're kind of have little things going on and it just is it a lot? Yeah. Sometimes my wife and I are just spinning, but it's kind of fun at the same time and we'll just see where it goes. So
Sounds
Right.
good.
Right.
All right. Yeah, we will also drop your links below for everyone who's
Hmm.
interested in checking out your socials. And who knows, maybe one day we will have an episode 2.